Hi everyone, I am Suresh Machu from Machu Tattoos. So today the topic is SNUG piercing. Yes, it's the most painful piercing comparing all the piercing sessions, and I'll talk about this pain level as well as the healing time, aftercare, and what jewels used in this video. Do watch this video completely to get the complete idea about it. And if you guys have not subscribed, subscribe our channel and click the bell icon. We are making a video on a daily basis about the tattoos as well as the piercing. Don't miss any of the update. Let's get into the topic. So what is SNUG piercing? So SNUG piercing is also called as anti-helix piercing. Anti-helix piercing is known for having a both entrance and the exit on the same side. Yes, that's why it's very painful comparing all other piercing. Usually on the ear, other piercings are having a different entrance point as well as the exiting point, but it's not like that. It's going to have the same entrance points as well as the same exit point on the same side. So it's going to be much more painful comparing other piercing on the ears. So in this piercing, people use the barbels or rings as the jewels on that particular place to get embossed. So in the SNUG piercing, people needs to understand it's going to be painful and it's not the easy through before getting it done, and it will take much more time to heal comparing the normal piercings. So pain in the healing time. As I explained to you earlier, it's going to be very painful. So out of 10, it's going to be painful about 9. Yes, it's going to be that much painful. So obviously we are going to make an anti-helix piercing on the hard surface, so it's very hard to penetrate inside, so it will be painful. And when talk about this healing time, it's going to be take at least 3 months to 5 months to get healed completely. So in the starting days, once you get pierced, 1 to 10 days you may feel little swelling around that place. That's completely normal. You don't need to get panic at all. So next, let's talk about aftercare. So when we talk about this aftercare, as we explained, sea salt water is the best solution for this also. But if you felt more pain, then you can use the painkiller for this piercing. Yes, so you can use the painkiller which is suggested. So some people are allergic for some of the painkillers, so you need to choose it accordingly, which is suitable for your body nature and the immune system. You can use the painkiller as well as clean it with the saline or else sea salt water. That will give you the best output. But in this duration, you need to be very careful while you do the hair wash, especially girls. If the hair stuck on that particular place, that will make more irritation. As well as while sleeping, you need to sleep very carefully because it's going to be on the same side of the entrance and the exit, so it will give the little more bulginess and a little uncomfortable while sleeping on that particular side. So try to avoid at least for 10 days on that particular side. You can sleep on either sides, and if you felt more pain or swelling, then my suggestion is remove the stud, let that heal completely, and you can pierce it once again. Because if you want that to be stay as it is, and if you plan to let it heal, then it will cause more serious infections. So before that, if you felt pain or swelling, just remove it, let that heal completely, heal that wound perfectly, let that infection goes off, then you can proceed with the piercing once again, and let maintain the complete precautions at the starting itself. Next, how to change this jewelry. So once you got it done, so after some time, we have the plan of changing the jewelry and make it with something different jewels on top of it, right? So at that time, it's better to go ahead with the professional. Don't change it on yourself, because SNUG piercing, it's going to be on your cartilage helix. So if you put it in the wrong direction, that will cause another pain. Because as of now, like almost 2 to 3 months, you are maintained it very well and you healed it completely. At the end of the time, if you want to change it, you should not mess with that. So if you plan to change the new, and then go ahead with the same professional artist where you got it done, so they can change it and they can help you out to change. So materials used for the SNUG piercing. Yes, so majorly they'll be used the ring or else curved bauble. So rings and the curved bauble, which are made by the surgical grade stainless steel or else anti-dioxide titanium coated. So if it's both are, then completely fine, you are not going to get infected for this particular material. And before doing it, you need to check that the stud got sterilized and they are opening it from the pouch, which is the sterilized. So normal box, you are taking it up and taking with the bare hands and putting it, no, that will cause the severe infection. So studs needs to get sterilized completely, so they will open in front of you and they'll be put it on there. So that's how the process of piercing needs to work to get the best output. I hope this video is very helpful for you guys, and I'm gonna add the fast facts after this, so you can check it out. The all the things what and all I said is summarized in that particular part. Until then, don't die new.